Hey, good morning, everybody. Thanks for joining us here. It's another beautiful day at Sierra Tucson, and I am Dr. Timothy Brigham here to talk with you this morning about body language analysis, specifically body language as a analysis as applied to clinical settings. So, for example, what we do here at Sierra Tucson, treating trauma, treating mood disorders, treating addiction. So, before we get into all of that, let me just give you a little bit of background about myself. My doctorate degree was at University of Georgia. I got to plug my Bulldogs here, national champions this year. So my degree, more specifically, was in cognitive psychology, kind of broadly defined. I did a lot of work in neuroscience, specifically schizophrenia and neural correlates of saccadic eye movements in schizophrenia. We'll talk a little more about eye movement stuff later today. Did some judgment and decision-making work. Looking at expert decision making using a Brunswickian lens model, if that resonates with anyone. I am a former assistant professor of psychology, and more recently here I've been doing clinical work at Sierra Tucson, where again we treat trauma, substance use disorder, mood disorders. And just want to point out here, one thing that I always think about when we talk about judgment and decision making is a lot of times we're measuring experts who have implicit ways that they come to make decisions, right? They don't always have a formal process that they can say out loud, right? So when we look at the process of making decisions and judgment and decision making, a lot of times what we're doing is kind of explicating the implicit, as I like to say, right? We're taking things that maybe experts don't always have stored in verbal terms, right? But we're trying to kind of make those explicit so we can all learn from those things and see how experts come to arrive at the decisions they do, right? What that process is. So here today, we're talking more about body language, and I want to point out just my interest in that arena from perspectives, including forensic perspectives, neuropsychological perspectives. I am going to bring in even a few interesting tidbits from human potential movements, neurolinguistic programming, psychocybernetics, a couple of areas like that, and just kind of roll in some information from different contexts, different settings in body language analysis, see how we can apply those to clinical settings like we're talking about here today. And body language in a sense, analyzing body language is an implicit thing that we all do. Right? We all do have these abilities to implicitly, right, look at and see what people's behaviors mean, right, their nonverbal behaviors mean, and we're going to try to make that explicit today, right? Kind of look and see if we can explicate some of that implicit information. All right. So I just want to share with you two brief quotes this morning. I promise I won't read to you, but I do want to share two quotes that'll kind of set the stage for what we're talking about. This first one: many nonverbal behaviors are unconscious and may represent a more accurate depiction of a patient's attitude and emotional state. They can belie a patient's anxiety regarding a specific topic discussed in therapy, despite verbal assertions that the subject is inconsequential and not causing distress. Right? So there, we're gonna return to this word again and again: incongruency. Right? Someone is telling you that something is not important, not bothering them, but we can see at a nonverbal level that behavior is reflecting that maybe it does. Right? One other quote here before we move forward, for those of you out there like myself who consider yourselves Jungians, right? This one from Carl Jung. The distinction between the psyche and the body is artificial. In reality, there is nothing but a living body. That is the fact. Psyche is as much living body as body is living psyche. It is just the same. And I present that because I want to kind of make apparent why it's so important to look at nonverbal communication, right? As we talk about not just the words people say, but how they say them, how they present themselves. Right? Okay, so when we talk about body language analysis, we're typically talking about kind of 5 categories of communication, right? 5 sources of nonverbal communication. And those are typically described as our facial expressions, right? Our gestures, including our arms and hand positioning, right? Posture, body posture, eye contact, and physical spacing between individuals. And we'll talk about each of those in a little more detail today. All right, so I'm going to give you a few general considerations to keep in mind as we talk about body language analysis, right? Some things to just keep in the back of your head. So first of all, rely only on multiple indicators. Right? If you're only using one cue, one behavior to determine something, that's not the way we do it, right? We have to rely on multiple indicators, right? Just for example, taking a person's eye movement and determining that must mean that they're thinking about a certain thing or going through a certain mental process. Just using one indicator is never reliable enough when we're talking about body language analysis. Also be aware of cultural variations, be aware of the situation, be aware of context, right? Those are gonna very much change the behavior of the person depending on that context, right? Just for example, people who are entering treatment voluntarily versus people who've been compelled to do so, right? That's a different situation. People from different cultural backgrounds, right? They're gonna bring that with them, right? So relatedly, look for a change from a baseline when we're talking about people's behavior, right? Really, really important to have a discussion with a client before we start to get into the heavy work to see what their baseline is, right? We have to have a comparison point to know what the changes are, right? And lastly here, be looking for incongruence, right? When someone says something's not bothering them, but they're presenting in a nonverbal way, some signs of anxiety, for example, look for that incongruence, right? If someone is saying yes, shaking their head no, that's an incongruence, right? What's going on there, right? And again, not that we're going to make a determination, right? But that is something that we want to look at in more depth, right? And if we're seeing multiple factors, right, multiple behaviors, right, maybe even more so, right? Okay. So again, just in terms of general considerations here, I want us to remember this one as I like to say, a first approximation. You can always ask yourself, is the person I'm looking at, is their body, is it opening or closing? Right? In other words, are they using a closed posture, or is their body physically closing up, shrinking away? Right? It could be an indication of anxiety, right? Hostility, right? Any of those kinds of emotions, as opposed to a more open posture, reflecting openness, willingness, friendliness. Right? So, if you don't remember all the details of the things that we discussed today in terms of what you might look for when you're doing your own body language analysis, do think about this one. Is the person I'm looking at, is their body, is it open, right? Or is their body closing? Right? So from there, I want to drop on you a few terms. Right? The first one, adapters. When we talk about body language and body language analysis, we use the term adapters. These are nonverbal behaviors that are satisfying some psychological need. Often that's reducing anxiety. So, for example, nail biting during a conversation. Right? Anything could be an adapter that's a self-soothing behavior, right? Rubbing the arms, right? Anything like that that can be viewed as a way that person is dealing with an internal emotion. Right? Another term, illustrators. Right? So my illustrators are nonverbals that are accompanying my words, right? Pointing, nodding, all these kinds of things, right? That I'm illustrating the conversation with. Right? Okay. Regulators. Now, when we use our nonverbal behavior to give feedback, right? So for example, just nodding, as someone is talking to you, showing that you're interested in the conversation. These are regulators. Right? You're regulating that conversation. Right? You're keeping it going, showing your interests. Right? So we've got regulators, adapters, and illustrators as three big terms. Right? Nextly, I want to briefly talk about how interpersonal spacing ties into this, right? The spacing between individuals. And that typically is referred to as proxemics. And this does vary by culture, right? So different cultures have different distances that would apply for different situations that would be considered acceptable, right? But here we're looking at, kind of a Western perspective when I give you these numbers just to illustrate that. I do also want to point out that we're going to talk a lot about amygdala involvement and limbic involvement. One of the things we're looking for is signs that nonverbal indicators that a person is experiencing limbic activation, right? Amygdala activation, signs of maybe fear, right? Perspiration, right? All those kinds of things. And the amygdala and limbic involvement does play in when we talk about space, right? If somebody violates your personal space, that amygdala starts firing, right? That smoke alarm, that fire alarm, that smoke detector starts going off, right? Why is this person in my space, right? So just four kind of broad categories of distance typically talked about in proxemics. Right? It's that intimate distance, right? Up to 18 inches to actually touching the body. Right? So that's your intimate distance, right? Personal distance, maybe talking with a friend, right? Well, a little more space there, between 1.5 feet and about 4 feet. Right? When we talk about social distance, right? Maybe being out amongst other people in the world that we don't know personally well, right? But we're having social interactions, right? We're talking there about maybe between 4 and 12 feet. All right. Lastly, more public distance, right? When we're out in the world, people we don't know, right? Somewhere 12 to 25 feet is typically described as comfortable for people in those kind of situations. However, think about, there are often times that you can't have this distance in public, right? You can't walk around in your life always demanding or expecting 25 feet of distance from other people you don't know, right? So what happens in situations like, for example, subways, right, where people are crammed in together? Well, a lot of research seems to indicate that there becomes a process there of almost dehumanization of our view of others, right? We start to think about the others surrounding us as if they're inanimate, right? They have no agency, right? And if someone does violate, again, your personal space in that kind of setting, hey, that's when we're going to see that amygdala involvement, right? Some fight-flight response start to come in. Okay. Also, I mentioned there is an alternate view of personal spacing, and specifically from a more neuropsychological perspective, right? Really based on how the brain handles our interactions with the outside world. So defined by nearness to the body and also cortical areas that handle these situations, these areas, right? These distances. And from the neuropsychological perspective, they use the terms parapersonal space. That would be within your arm's reach, right? You can reach out and touch something in your parapersonal space. That extrapersonal space, right? Outside of your arm's reach, right? But still within your bubble, right? And percutaneous space, the space just outside of the body, maybe not always touching it, right? But stuff that can have an impact on your physical sensation. So for example, feeling the wind blowing against your body, right? And again, from this perspective, this neuropsychological perspective, all these three things are handled by different neural pathways, right? So there are actually different brain areas and tracts of neurons that are devoted to dealing with these three sets of spaces. Okay. I want to bring in now something that I think is very important. A lot of people find extremely interesting, right? The eyes being the window to the soul. Right? And we're going to talk now about how we can utilize behavior that we see from people's eye movements in terms of trying to kind of figure out what's going on, right? As signs of maybe what the internal dynamics are there. Right? Again, remember, we're talking about limbic activation in a lot of cases, right? When we see what we're seeing are external signs of maybe internal fight-flight response, right? So here, in terms of the eyes, I want to talk about blink rate first, right? So, if you see blink rate changing, if you see a person blinking more frequently during a conversation that's intense, for example, right, there's something to look at, right? Something to notice, right? As well as pupil dilation, right? So the shrinking or expanding of the pupils. And most generally, right, again, if I use the term as a first approximation, right, pupil dilation or enlargement is usually reflective of a positive emotion, maybe a desire. Think about it as your eyes are opening, your pupils are actually dilating because you want to be able to bring in more of this positive stuff. Right? Whereas pupil constriction, right, shrinking down of the pupils, often indicative of a more negative emotion, right? Maybe fear, right? Maybe some of that limbic activation, being afraid, being worried, feeling uncomfortable, right? Those kinds of things. So remember, we're looking at eye behavior, right? That's a good sign of limbic activation, so showing kind of internal activation of that fight-flight response. All right. Okay. Bring in something here a little more controversial, but pretty unique. Some of you guys may have some familiarity with having heard of this before. Eye accessing cues, right, from that human potential movement stuff that I discussed earlier, right? Specifically neurolinguistic programming, right, from the 70s. This idea that certain eye movements are reflective of internal processes, right? So for example, you can see here at the top, looking up, right? Your eyes floating upwards towards the sky, right? Usually reflecting some kind of visual activity, right? And you also see here that with this perspective of neurolinguistic programming, we also get is that something that's a memory, right? Is that recollecting a visual memory, right? If so, that might be an up to the left, right? From your own perspective, right? Think about your eyes going up and to the left, as possibly reflecting when you're trying to recall something that you saw, right? Versus those eyes moving up and to the right, other direction, but still upwards, right? Could be trying to visualize something that you've never seen, right? So this is where we start to get into that stuff about, can we use eye accessing cues and body language to determine when someone's telling that someone is trying to be deceitful or lying, right? A lot of mixed results on this. I will say that I know a lot of people with a lot of experience do find the eye accessing stuff very, very useful. I've had them tell me that. Right? Looking here at auditory, right? We do have eye accessing cues that represent auditory accessing, right? To the left, recalling what a sound sounds like, right? Recalling a song, right? Something like that. Versus those eyes being kind of still center, but to the right, right? Maybe maybe imagining how something will sound. Right? They give the example here, writing a poem, right? Those eyes being center line still, but drifting to the right, right? Then lastly, we have the feelings and internal self-talk, right? Those are more downward eye movements, right? Down to the left, typically reflecting and maybe reflecting internal self-dialogue, right? Listening to that voice inside the head, versus downright, right? Recalling emotions, recalling physical sensations. Right. Now, as you see, I did note here that your mileage may vary. Again, there is a lot of mixed results in terms of this idea about eye accessing cues. But from this neuro-linguistic programming perspective, at least, that our eyes are reflecting that we're accessing different representational systems inside our brains, so to speak. Right. So, if this is something that you find useful, try it. I've had, again, many experienced clinicians and people from different arenas where body language is used say that they do rely on this a lot and that they do find it very useful. I want to bring in something here that one of my kind of online mentors, if anybody here is interested in body language analysis, the Behavior Panel have a great channel on YouTube. A lot of guys who do criminal work and interrogations, different kinds of in those arenas. This one from Chase Hughes at Behavior Panel. Right, he gives the example of, I'll use his example, right? You're giving someone a sales talk, right? You can see that their hand is on their arm, and as you're discussing these things, okay, things are going well, but suddenly you start discussing interest rates, and hey, suddenly that hand squeezes up, right? Hand closing up, and maybe that's reflective of some kind of discomfort, right? Maybe getting to a spot we don't want to be at, right? In terms of the conversation. I mean, think about that, how that even ties into our responses as babies, right? That hand opening up to accept the bottle, right? My hand opening might be more reflective of of acceptance of this conversation, right? Versus closing up, right? Might be reflective of, hey, I'm not into hearing this. Right? Okay. Microexpressions. This is a popular term these days in terms of body language and body language analysis, right? And when we're talking about microexpressions, what we mean are really quick, but sometimes full face expressions of emotion, right? They may be very, very fast. They may be partial, maybe subtle, right? But they are very, very quick and unconscious, right? A person may oftentimes have this as their reaction, but then they want to try to control that more. Right? They want to try to change that face, right? Sometimes these can be as quick as a 15th of a second, right? Half a second, 10th of a second. So very, very brief displays, but if you're looking, you can pick up on these quick displays. Also, for those of you who do clinical work, if you're videotaping your interactions with clients, study those things and see when you can slow them down. Right? What are you seeing here? Microexpressions can also be thought of as a form of leakage of information. Right? Maybe I'm trying to keep information back that I don't want to let out there. Right? Maybe it expresses itself in my face very briefly, but then I realize that and I try to close it down. Right? All right. I want to go through just a few other kind of behaviors of note here and things that you might look for as you try to apply these things to your own settings. Right? Well, you've got the lip curl, a classic, right? And I've listed a few things here that you might think about the lip curl as representing. Right? Maybe some disapproval or distress. Right? Maybe some false bravado. I'm giving that very, very dramatic facial expression to indicate something. Right? Maybe some contempt, hyperbole, kind of maybe going along with false bravado. Right? Maybe some suppression of emotion. Right? Trying to just my lips folding back, trying to repress this emotion that I don't want to let out. Right? Or again, maybe some deception or guilty knowledge, holding some information back that I don't want to let out there. All right. Note here again, when we're talking about limbic activation, right? When under stress, the blood vessels in your lips do constrict. Right? Lips may actually become smaller, visibly smaller. Right? That is another indicator that somebody is activated at a limbic level. Hard to fake that one, by the way. If you see someone's lips, those blood vessels constricting, their lips even seem smaller. Right? That's a good indication that there's some limbic activation going on there. Right? Just a couple others here. We've got the half smile. Just smiling with that one half of the face. A lot of times this is seen as a pretentious kind of thing, right? Maybe reflecting a sense of better than other. Right? Maybe also some leakage of info. Half of my face is expressing one thing, the other half is not. Right? Maybe uncertainty. Maybe I don't know how I feel about this. Right? And just half of my face is showing that half or that part of the emotion. Also, the suggestion, maybe there's some duper's delight here when you see this. Right? Maybe somebody feels they're getting over on you, so to speak. Right? Maybe they feel like they've been able to hide something from you or so forth. Right? So various ideas, and of course the thing with body language analysis is we're not taking any one cue. Right? We're using all these things in context when you're seeing multiple indicators. Right? Nothing in and of itself by itself as indicative of internal activity. Right? Tying back to open versus closed as just general body posture. Right? Closed arms indicating maybe feeling closed off, feeling defensive. Whereas hands being on the hips, maybe more of a sign of being in control, even a sign of aggression, depending on the situation. Many of us, including myself, will often fall to the hand, closing the hands behind the back. Right? Sometimes that can, though, come across as the person being bored, right? Being angry. So just be aware of how that's being picked up on by your clients, for example. Right? Really quickly, so we can move forward, I want to mention one other one that I find myself having to remind myself not to fall prey to sometimes early in the mornings doing therapeutic groups. We gotta remember not to do my dancing bear, right? That rocking from side to side as I kind of get rolling. That can be considered an adapter. Right? It is a self-soothing kind of thing. Right? This is my way of maybe dealing with that anxiety I'm feeling at that moment. Right? That rocking back and forth. Right? All right, I do want to mention just a few things in terms of the research on body language analysis. Right? What is really important? What's been found to be useful or important versus what's not. Right? First, here just a few things to try to integrate in your own presentations. Right? We see here the persuasiveness of a speaker typically includes these kind of nonverbal behaviors. Right? Making eye contact, forceful gestures, right? Using those hands, using those arms, keeping an open body position, doing a lot of head nodding. Right? Close distance, pleasantness, fluent speech, and having moderately loud tones, moderately fast speech, but a lot of variation in pitch. Right? Those are all things that have been significantly correlated with finding someone persuasive, right? Finding someone as being a good communicator. Relatedly, there's been a lot of body language work done on presidential debates, right? How a person's nonverbal behavior during debates like that plays into the results. Right? Carter-Ford debate. We see that observers talked more favorably. They rated favorably segments that had less tension and adapters that would be related to tension. Obviously, the example I used, nail biting. Right? Thankfully, Carter didn't bite his nails, but hey, that kind of thing. Right? Using these adapters that people recognize on that implicit level is showing that you've got some tension. Right? Licking those lips, for example, that sway, right? That dancing bear, the rocking bear. Right? Increase in eye blinks, things like that. Non-fluent speech. Right? Those things people pick up on an implicit level. Right? When Carter debated Ronald Reagan, one thing that was pointed out as being a problem for him was he was not able to keep his behavior congruent, his nonverbal and verbal behavior. Right? So again, I'm demonstrating in a verbal sense one thing, but in a nonverbal way, I'm showing something else. Right? And again, people pick up on those things, even if they're kind of implicit knowledge. One other mention here about a debate with studying the Bush-Clinton debate, we do see that when you try to teach someone to act charismatically, if it's not seen as spontaneous, that may backfire. Right? So trying to integrate these things, try to do it with some spontaneity. Right? Not just self-training to do these behaviors in a routine. Right? But some spontaneity. Right? Our nonverbal communication, I just want to point out, is the product of both biology as well as social learning and all that relational cultural stuff, right? So there are multiple factors here that play in. Right? I want to mention, because someone always does ask, what about lying? Can you tell when somebody is lying based on body language? Well, mixed results. Most of the things that we think about as being correlated with lying, right? So most of the things we think about as seeing what you would see from someone who's lying have been found not to really relate to that. Right? What you may see, and again, some mixed results, right? People who are lying may use fewer illustrators. Right? They may show more tension-related adapters. Obviously, more nail biting. Maybe they're worried that they're going to be found out. Right? Some increased latency. Right? How long it takes them to start answering a question that you've asked. Right? And then changes from the baseline, right? If you have a baseline for that person, and their tone and rhythm of their voice, right? Even some results have found some changes in the number of foot and leg movements they may move, that they may engage in. Right? Speech often becomes more abstract, right? Less sensory detail is integrated into the talking. Right? There's more abstract stuff, but less detail. All right. Okay. Briefly, want to talk a little bit about mirror neurons. Right? We're talking about body language here. This brings in, we talk about empathy. We talk about mirroring others and engaging with others. Right? Ramachandran, neuroscientist Ramachandran, even says mirror neurons are the basis of our civilization. Right? They allow us to mirror others. They allow us to engage with others. When we see someone else experiencing something that that there's a part of us biologically that a cell that fires, right? Neurons that fire, and we have observed those mirror neurons in primates, birds, as well. I am going to jump over here some of the work on autism and mirror neurons. Other than to say there has been the finding that in children with severe autism, mirror neurons do not seem to be functioning as well. Right? So when they are asked to, for example, imitate faces that they're shown that are expressing emotion, they may try to do that, but they're not showing that mirror neuron activation. Right? So that seems to be a deficit there in that system. Okay. Here I want to mention briefly some specific tips for clinical settings. Sorry, guys. My timer's getting low. Right. One from psychiatrist Fritz Perls, who gives us this advice. Think about trying to maybe sit at an angle to your client. Right. Maybe not doing a face-to-face on directly, face-to-face, knee-to-knee. Right. Perls advises, hey, we can use the rods, right, and the kind of as opposed to our cones in the center of our vision, right, our rods, the external, right, the kind of the outer rim of the eye picks up better on subtle changes, right. So maybe we can, utilize that, and you're noticing those subtle changes, keeping maybe having an angle to the client, maybe allowing you to pick up on some stuff in the periphery of your vision, right. Also, Pearl says patients may be anchoring negative emotions into what's right directly in front of them, right. So consider that. Something to think about. However, don't use this as an excuse just to type and talk, right? Not the idea. Want to mention briefly here another idea from a controversial figure, Wilhelm Reich. Right? A lot of far out ideas. One of which applying here today, though, is this idea he presents of character armor or muscular armor. Right? The idea here being that we get into these patterns of things like our posture, right? The way we carry ourselves, our physical act, our nonverbal behavior, right? We carry these things around with us, right? And they become a physical state of our muscles, right? The way we move, the way that our muscles rest, and the way they interact with the world. He refers to these things as character armor, right? We build these things up over time. Okay, so just as we close here, a few more tips for clinical settings specifically. Be looking, right, for changes in things like blink rate, changes in respiration, right? Again, those are signs of limbic activation, right? Maybe signs of some distress, anxiety, right? Fear, things like that. Make sure to maintain good eye contact, right? But no staring contest, right? There is what we call the 50-70 rule, right? When you're talking to someone, maybe when you're speaking, maybe keep that eye contact about 50% of the time, right? Diverting occasionally, right? Not trying to keep a staring contest going, and when you're listening, maybe that should change to about 70%. Right? Now that I'm listening, show a little more, little longer engagement, right? Before breaking that eye contact, right? So 50% of the time while talking, 70% of the time while listening, keep that eye contact going, right? Also be congruent but sincere, right? Make sure your nonverbals and your verbal behavior are congruent, right? But be sincere, as we mentioned. If you're doing something and it is insincere or it's a trained thing, that does show, right? People can implicitly pick up on the fact that it's rehearsed, right? All right, so hey, smile, right? Warmly, like Mona Lisa, as they say, right? And remember, here's an important point, that nonverbal behavior is a predictive factor of how patients are going to feel about their doctor, their practitioner. Right? If we measure a patient's feelings and thoughts and so forth about a practitioner before they've even interacted verbally, right? A client oftentimes makes a lot of those initial first contact assumptions, right, based on that very brief first interaction, those nonverbals that occur before you even said anything to the person, right? And people will say that their doctor, their practitioner, their therapist was more or less knowledgeable, depending exclusively on how that nonverbal behavior went, right? We've seen that in research. Right? Okay, more generally, hey, keep that posture open. Use affirmative movements, right? Show empathy by nodding your head, things like that. Keep, again, that eye contact. Hey, remember, it's important. Right, 50-70 rule. Keep it, but make sure you're not engaging in that staring contest, right, which could be seen as threatening, for example. Right? More generally, hey, arms. Don't keep your arms crossed. Try to either have your hands in lap or maybe hanging down at the side. Right, are the tips there. Handshakes. Hey, have a firm handshake, but not crushing. Right, it's not a contest. Right. Use those hands and arms to illustrate, and as you're talking, be engaged. Right? Avoid touching the face. It's often seen by people as a sign of dishonesty. Whether or not it actually does reflect dishonesty, people do kind of assume that it does. Right? So if I'm fidgeting, touching my face, there might be an interpretation. There's some dishonesty going on there. Right? And again, nonverbal behavior plays a huge role in first impressions. Right? That first initial nonverbal stuff says a lot about how a client is going to perceive their doctor or their therapist and how much knowledge they think that person has. Very interesting there, I think. Right. Okay, that brings us just up to the references. Let's see if we have a couple of questions before we run out of time here. And let me see what we got. Oh, here's a pretty direct one. What's the average blink rate for a person when, so say they're not activated, right? They're not in fear, they're not in a limbic fight or flight state. What is an average blink rate? Typically, it's described as between 12 and 15 blinks per minute, right? Again, a lot of that depends on baseline. Individuals vary. There's a lot of individual variability. But if I've talked to that person yesterday or before, I have some idea about their norm, right? Their baseline. 12 to 15 per minute being the short answer there. Right, let me see what else we've got. Is there research that backs up the idea of the eye accessing cues? Again, there are mixed results there. Some research has been found to be supportive of the idea of eye accessing cues. A lot of it has not. Right? Again, your mileage may vary. However, I have had people who have a lot of experience in clinical areas and forensic areas that rely a lot on eye accessing cues. And hey, the research be darned, right? They say it works for them. So again, if it's something that your mileage may vary, but try it and see if you can make use of that. All right. Related question here on eye accessing: is there a lot of individual variability, and does it matter if someone is intoxicated, if they're left-handed, if they're mentally ill, etc.? Right. Okay, good question, by the way. That eye accessing, those representations are typically thought of as flipped for a left-handed person, right? So when we were saying up and to the left, up and to the right, that would be oftentimes thought of as being the reverse for a person who's left-handed, right? That would probably be the only major caveat, right? Is the handedness thing. Intoxication, mental illness, generally from what I've seen, what people have told me, does not seem to, someone who's intoxicated, it probably won't play a lot into whether their eye accessing cues are normal or not. My background, again, my neuroscience work in schizophrenia, though, we do see that in terms of people with schizophrenia being able to make smooth saccadic eye movements, as we call them, right? Your eyes moving from one thing to the other, right? There does seem to be a deficit in that in schizophrenia, and that does seem to be related to a very biological thing there, right? So some suggestion then maybe that in disorders like schizophrenia, there may be some differences in the eye accessing. Right? And let me see if we have time for maybe one more. What would you say is your major take home for those of us who wish to start studying body language analysis? Again, I'd fall back to that first thing that we kind of discussed as that first approximation, right? Just remember to ask yourself, is this person's body opening or is it closing? Right? Especially when you're engaging in a conversation. Are you seeing that person shrink away? Are you seeing physically closing up with the hands, closing up with the limbs, right? Or are you seeing more openness, right? The person is engaging, you actually, right? Illustrating connection, positivity, willingness, things like that. But we are out of time for the day, and I do want to thank all of you for joining us here today to have this discussion. Hopefully, you can join us for more webinars in the future from Sierra Tucson. And again, thank you guys so much, and I hope everybody has a great day.